When we talk about obesity, we have learned that it's not just about body weight. It's about health, life, and the quality of years we get to live. It's just not a cosmetic issue, it's a medical one. The truth is, obesity affects every organ system and is a central driver in the pathophysiology of nearly all chronic diseases, from heart disease to diabetes to cancer. If left untreated, it shortens lives, burdens health systems, and impacts families and communities. So today we are going to talk about the consequences of not treating obesity and why addressing is not just important but imperative for the health of our communities. Number 1, morbidity and mortality. Let me begin by explaining what mortality and morbidity mean. In medicine, we study the impact of any disease through these two key terms, mortality and morbidity. To understand them, let me explain them further. Mortality means death, how often a disease can kill. For example, if 100 people have a disease and 5 die from it, the mortality rate is 5%. Morbidity, on the other hand, means illness, how much a disease impacts your daily life, your quality of life. For example, someone with diabetes may live for many years, but they might develop problems like kidney issues, nerve pain, or vision loss that can impact their quality of life. Another analogy is imagine a hurricane hitting your town. Mortality is how many people are killed by the hurricane, whereas morbidity is how many survive but live with injuries or damaged homes. Linking this to obesity, let's talk about mortality and morbidity. Obesity is an independent risk factor for premature death. All-cause mortality increases progressively with higher BMI, especially over 30. In the U.S., obesity is estimated to contribute to about 300,000 deaths each year. Severe obesity with BMI greater than 40 can reduce your life expectancy by 5 to 20 years. It quite literally shortens lives. Now, how about morbidity in obesity? Even before death, obesity burdens the body with illness across every system. The number one system that's affected is cardiovascular. The cardiovascular diseases are the number one cause of death worldwide. You've heard of high blood pressure, heart disease, heart attacks, stroke, heart failure, atrial fibrillation or other arrhythmias, peripheral vascular disease, and many others. The next system that's very often affected is the metabolic system, type 2 diabetes, and the risk increases exponentially as the BMI goes up. Then abnormal cholesterol, dyslipidemia, metabolic syndrome, respiratory problems include sleep apnea, obesity hypoventilation syndrome, worsening of asthma and COPD. It also impacts gastrointestinal and liver, so gallstones, reflux issues, irritable bowel syndrome, the gallstones, the metabolic steatotic liver disease, which is also called as fatty liver, are all examples of how obesity affects the gastrointestinal system. The next is the musculoskeletal disorders like osteoarthritis, knees, hips, chronic back pain, reduced mobility, and even risk of falls. Obesity is also linked to at least 16 types of cancers, which include colorectal, postmenopausal breast cancer, endometrial cancer, esophageal, gastric, pancreatic, liver, kidney, gallbladder, multiple myeloma, and meningioma. There are also possible links with male breast cancer, the fatal prostate cancer, and lymphoma. Obesity also affects your reproductive and urological organs. Infertility is commonly associated with obesity, polycystic ovaries, pregnancy complications, erectile dysfunction are all linked to obesity. Now, let's talk about the psychosocial impact. Depression, anxiety, low self-esteem, stigma, discrimination, and bias are all associated with it. Now, let's talk about scope of the epidemic. Let's talk numbers. Globally, in 2022, 1 in 8 people worldwide were living with obesity. Adult obesity has doubled since 1990, and adolescent obesity has quadrupled. 2.5 billion adults were overweight, with 890 million are in obese category. In the United States, more than 2 in 5 adults, which is 42.4%, have obesity, and 1 in 11 adults, 9.2%, have severe obesity. Nearly 1 in 5 children, just 19.3%, have obesity, with 6.1% of our children are in the severe obesity category. If we include overweight along with this obesity statistics, 75% of US adults are affected. And here's the most sobering fact. In the last 40 years, no country in the world has made meaningful progress against obesity. This begs the question, what are we doing wrong? Where are we going wrong? Where is our understanding and our treatment plan limited? Why I do this work and also practice obesity medicine is where my why comes from. As a physician, I see every day how obesity is the common thread behind so many medical conditions: heart problems, diabetes, joint pain, infertility, even cancer. This isn't about vanity. This is about saving lives and improving quality of life. That's why addressing obesity is imperative, because if we don't, we are not really addressing chronic disease at the root cause level. In conclusion, I would like to end with that obesity is not just a health issue. It is a central driver of all chronic diseases, just like I discussed in this video. It shortens lives, it steals the quality of life, it fuels almost every chronic disease we treat, and that's why we must take it seriously as clinicians, as policymakers, as communities, and as individuals. In the next episode, I'll share how I approach obesity in my clinic and how this model can translate to everyday life.